Shalom. Shalom. You have a mixture. A very brofunichi. Please, I don't understand Gan, so you pardon me. So today we are talking about breast cancer, and I'm sure we've all heard something about breast cancer. Yen na ye we nufu aha ana me bua remember no. Mu we nufu sana ma no so yen so we nufu nti obia a we nufu bia timinya breast cancer. So your ba no be ma just that a man no e na edosun. Enti me de please can we start? Yes. So this is how the breast is supposed to look like. Already there is a lump in everyone's breast because that's where those things you are seeing come from. That's where the milk is produced. So that's where the milk will come from. So this is how normal the breast is supposed to look like. Round, with no single nodule anywhere. All those round things you are seeing, they are ducts, and then they produce breast milk. No, not far into as milk. So the reason why we are talking about breast cancer is because worldwide, breast cancer is the second most common cancer killing people in the whole world. And in Ghana, please can we move the slides? And in Ghana, a lot of women come when it is late. And if it's detected early, there is cure. But when you come late and the cancer has already spread, the cure is not possible. We just manage you conservatively. But if you come early, we can cure you where the cancer will go away and you wouldn't experience the cancer again at all. So that is why it is very important we are talking about breast cancer. When we say cancer, cancer is any cell that grows out of proportion. Every day, your body knows cells need be nyini. That's how normally it's supposed to be. But cancer occurs when the cells, the cells that are supposed to die, they keep growing. Then it becomes a nodule, then it forms cancer. So breast cancer is any cancer that starts in the breast. And any cancer can spread. Into a breast, no, a pure kitwe. By the time we will not jinufuni in alpha, then it goes into your blood. Then it can go to your brain, it can go to your chest, it can go to even your bones. So breast cancer, when it's not detected early, can spread to every part of your body, and when it gets there, it's difficult to cure. So as I said, breast cancer is the second most common cancer worldwide. It is the number one cancer in women. And in 2022, there were about 2,296,840 new cases of breast cancer worldwide. And in Ghana, over 4,000 women are diagnosed annually. So you can imagine the number of women. It's because sometimes we are not in the hospital, so we don't see. But we see them a lot. So there are some myths about cancer. One is that, is tobacco the only cause of cancer? No, it's part, but that's not the only cause. Wearing a bra with metals or wearing bra for long doesn't cause cancer. When you have cancer, it's not death sentence. There is cure if it is detected early. And when somebody has cancer, when you sit by the person, it is not transferable. Cancer doesn't spread when we take biopsy. We'll talk about that shortly, the biopsy. And treatment is not always painful. Of course, if you have the cancer and you have to undergo surgery, you will have some pain. If you have to undergo radiotherapy, you may not even feel any pain at all. There are sometimes you can use certain medical treatments to kill the cancer cells, and that one you may not experience any pain at all. So what are the risk factors? Once you are a woman, your risk of getting cancer increases compared to men. Then age. Cancer increases with age. Every cancer increases with age. But in Ghana, we are seeing younger women coming with cancer. saying that it doesn't mean men don't have cancers at all. There are some few men that have been diagnosed with cancer and it's aggressive, meaning that it spreads very fast when men get it soon. And sometimes people have genetic problems, genetic mutations in their body. So once you have these genetic mutations, meaning that your genes have a problem, and that can predispose you to getting cancer. So it's not only breast cancer they can get. Once you have this gene problem, they can get endometrial cancer. That's cancer in the womb. They can get cancer in the ovary. They can get cancer even in the intestine. So those who have this genetic problem, they have cancers everywhere. So once you have one cancer and we've diagnosed you that you have genetic problem, meaning we have to screen you for all the other cancers that you can get. If your mother or your father has gotten cancer before, you have the risk of getting it. And since you are talking about breast cancer, if especially your mother, your auntie, your grandmother has ever had breast cancer before, your risk of getting cancer is more than somebody whose family member has not gotten cancer at all. Please, do you understand? But if your family has it, doesn't mean that automatically you get it, but just that the risk at which you may get is higher than somebody whose family doesn't have any history at all. And if you yourself, you had cancer before, you can also get breast cancer. You can have cancer in your ovary, and it can lead you to get cancer in your breast. If you have menstrual, I'm talking about menstrual periods. If you have early, those who have their menses very early, like let's say 8, 9, they get their menses, then late menopause. You don't have menopause early. Some people can get to up to 55, almost to close to 60 before they will experience menopause. If that happens, what actually causes the cancer is the hormones we call estrogen. It is more in females. That is why females are at a higher risk of getting the cancer. So this chemical, the hormones we are talking about, is produced in the ovary of every woman. But men also have small amounts of this estrogen that we are talking about. So if you have higher exposure to this estrogen, meaning that if you have your menses very early, that is when the estrogen starts being produced. So if you are, let's say at 9, you have your menses, then you are going to get to menopause, let's say at 55. You will be more exposed to this estrogen compared to somebody that will have the menses as let's say 14 and have menopause as 45. So the exposure, that is why we are talking about menstrual period. The same applies to having children. Somebody who has never gotten pregnant before, it's more because every month this woman will be having her menses, she's more exposed to the estrogen that I'm talking about. But once you get pregnant, these estrogen levels come down and other hormones come up. So when you are pregnant, you see you don't menstruate. So when you are not menstruating, the estrogen that is being produced is low. When you get to menopause, the estrogen that you are producing is low. So your exposure, when you have children, when you don't have any child, your exposure to estrogen is more. So you are more at risk of getting cancer. Then we have these birth control pills, the combined oral contraceptives that we take. Some have high estrogens in them. So if you are exposed to it more, your chances of getting breast cancer is also high. I talked about breastfeeding. So if you don't get pregnant, you wouldn't breastfeed. And if you don't breastfeed, your estrogen level is also high. So you are more exposed to the estrogen, and so your risk of getting cancer is high compared to somebody who has been breastfeed. Let's say the woman has 5 children. Meaning that every pregnancy, she will not menstruate for let's say 9 months. Then after giving birth, she will breastfeed for let's say 2 years. So that woman is more protected than you who has never been pregnant before. Please, do you understand? If you have any question at any point, you can stop and ask. Or after everything, okay. So they said after everything, and we asked our question. So you can jot everything down. All right, so this talks about the same thing. And I want to mention that sometimes certain pesticides and radiations also exposes us to breast cancer. Especially if you are somebody who likes going to do chest X-ray, everything, you are going to do X-ray, everything you are going to do X-ray. You are being exposed to more radiations. Your risk of getting cancer is high. Then pesticides that we use, some of them contain certain chemicals that affect our bodies. Then overweight. If you are here and you are overweight, start making plans to reduce your weight, because the more fat, the more you are obese, the more fat you have. And one thing is that the fats help convert certain chemicals to estrogens. So if you have more fats, you are converting more chemicals to estrogens. Okay, sorry. Thank you. So the more it is also fat ne wo mu ne dɔɔso ɛna fat ne wo mu bebree a wosesa nneɛma bi ɛwɔ body ne mu ɛkɔ estrogen chemical ɛwɔ your body na meka ho asɛm ne nti more na fat ne wo mu no more na we produce more estrogen nti the more a greater risk of getting the cancer. Woyɛ obi a wonyɛ exercise at all it is not good. Okay, so obi or cancer now, if somebody has cancer, what is the person going to experience? So the truth is, at the early stages, you may not have any symptoms at all. No changes may be seen. So that's the risk, or that's the disadvantage. But as the disease progresses, say, yare no eko nenima, ube start hu se bia we nufu kala asesa, we nufu baako aye kesesen baako. Utimi hu se aba abeda we nufu nim. Ebu wo nso a utimi hu se we bia we nufu no onepo no we nufu na no baby a wodi makola ne nufu no utimi hu se ebia na ye stress se ekọ one direction. Anas ekro bi abeda ho. Anase ebia ntokontoko bi abeda ho te se de wa ekutuo se obi ehu ekutu de wa ne ho ne te no unse ntokontoko bi nkitinkiti bi ekutu ne ho ebu oha ye nufu no etimi apia saa enti ebu onso a nsuo ana moja etimi free enufu ni mu ba we nufu ba ko timi ye kesesen ba ko enti bibia saa e was say utimi ko hospital na ye hwema wo but we obi a untai examine we nufu a you may not notice these changes. Say when you fune sesa, ebi a wadwe enkoso. Enti na you advocate say every month be we all menses we at least 2 to 5 days. She when you fuko jina she mu ne she when you fune she say etesen a. Se na be a any changes be you can report quickly to the hospital. So this is also talking about so these are some of the changes. Please can we change the slides to the other picture next. So these are some of the things you can see with your breast that should prompt you. And you are to say, "Dear me, we will make you me cancer and any cancer." But want to mean charges or hospital no ma share amount. Ain't apart from no funa, obe changes no. Se ekonenima eye advance edu last stage obu oha obeba hospital so ntumi home ube examine ewie ne say cancer na akọ ne chest, and that's the very first time we are even seeing say nipa no cancer. So at this stage it has already spread and the cure will be difficult. Obu oha akọ ne liver ntama ne ni na ye yellow jaundice, obu oha ne funa ye kese etimima uti pai will because akọ brain ni mu. It's mima unya coma cry na unya convulsion seizures crat me ba also. Na ye hu adan na ye betumi aye aboa ye betumi hu say we cancer na nye cancer. Enti uba first ye be bisa onsem kakra na area ya examine from head to toe na area ya hwe we nufu no nso ahwe. Enti ye hwe bibia area etimi cho say we etumi cancer na nye cancer. Say ye dwen say etumi cancer ye be ma wakoye mammogram ye the scan of the breast ye the back home. Ni nyina ema ye very good idea say cancer no say the ye hu na ye cancer na ye cancer na ye cancer so how it is spreading. MRI ye do ba kwhye machine mu scan your whole body. Yes, scan a etimi hu baby cancer cells ni nyina kwhye. Ena say ye ka say we ye cancer ye beti wenufu tissue ni bi ni e dia collab ye de collab ye nyema bebre e wo hom. First thing is say ye hye say cancer no ye was stages. Enti ye hye say cancer no edu stage ben ana. Enti ye was stage 0 to 4. Enti 0 ni che say cancer no enko enyandu moje ni mu kra is just within your skin. Stage 1 say cancer no less than 2 cm. And you use sizes. Less than 2 cm. You do 2 is between 2 to 5 cm. You do 3 is more than 5 cm. You do 4 I just say I call a beer with chest. I call with tea. I call a beer with bones. And I call baby home fan or lungs nimu. So that's the final stage, and that's the serious one. And you see, o breast tissues ni bia de collaba. Yetimi boa ma yehu san yema we. Ye wo se ne America no me sha se me ka say bibi wo ye friend estrogen. Eno na ma yenya cancer no. Enti se yeti breast tissues ni bi nso a ye de collaba. Ye hwe say estrogen cells no estrogen receptors no wo cancer ni mo ana say any cancer, because our cancer ni mo the treatment is different. Any cancer no the treatment is different. And I afraid bibi hair too. And also bibi a share say tissue ni bia, because and also the treatment no different man. Ye befa umoja ni akola ba hwehwem say bia cancer no ama umoja level na e form and e strong. Na ya chest x-ray so ahwe say bia o lungs no cancer cells na dru ho ana. Maka stages ni that treatment no ye diagnose on breast cancer na obia ni treatment is different, because we look at so many things. Say estrogen receptors ni wo ha, treatment is different. Say HER2 receptors ni wo ha, treatment is different. One kasa say we do menopause, our treatment is different. We do menopause, our treatment is different. And how advanced the cancer is, say do stage 4 compared to obia stage 0 and stage 1, your treatments are different. And so obi ka to say bia ukwa you be try enufu, ukwa you be try enufu, it's not always true. You assess so even your health is very important. You assess so near just say wuni pay surgery ne be boa ana wuni pay ebia medical ne be boa ana ebia chemotherapy ne be boa ana say radiotherapy ne be boa ni ya ma fefefe ye nka say obia will undergo surgery, ye nka say obia benya chemo ana obia ebenya radiotherapy. So the treatment modalities na makan there was surgery. There was surgery, there was chemotherapy, there was radiotherapy, there was hormonal therapy, and targeted therapy. Into surgery, no, and yes, I call you were no fooling na debi. Send ya make no, it depends on your stage. And to say be a cancer, no, ever no fu anuki to be a yetimicha one pe, baby a cancer ne penny war. Na ye ja we no fu kesina, na we are reconstructive surgery amount, na we no fu na be fair. Say be a cancer na spread ya ko enufu ni nyina na ye twa we enufu ni nyina. Sometimes ya motum doa bi timi besi wo ye friend lymph node. Sa ko lymph node ni mu a ye be yi lymph node no nsosom. Say obi o ha ye surgery ni bi ohia chemotherapy na kile chemotherapy say ye de chemicals ye be ma we dro na chemicals a kill fast growing cells. Enti because cancer no me say is fast growing into drugs no ebetimi akọ kill cells no cancer cells no, but the unfortunate thing is say because your body now, cause every time your hair is breaking down growing, your skin is breaking down growing into your mouth chemo now it enye cancer cells no kwa na affect every growing cells be it me affecting na, but your mouth chemo no continues e be your man weekly and now every 2 weeks. And see, your schedule is such that if you are once you undergo chemo, your body, your immune system will come down small. It will some time to recover. Then we'll give it. So we give it in sessions. Sometimes you can go for at least 6 sessions. Since your man is session, your body can withstand it. With the therapy, so you don't question machine anymore. Baby, a cancer ne one. You be focus. You the high energy source. Kill cancer cells na ewo breast ni mu no. Nti no so you may not even feel any pain at all. As a quiet x-ray. So yembo ya x-ray that question there is no pain, there is nothing one see. That's how the radiotherapy is, but it kills the cancer cells. And also suggests that sometimes baby the radiation the place may be darkened, may be red, or you have some skin changes. Kakra or and but the cancer cells will be killed. Hormonal therapy no estrogen hormone say na say estrogen ni bi wenu fu ni mu a sometimes you may not even need a surgery. Inti ema wo drug ebe blocky estrogen no ewo wenufu ni mu. Se na be ya cancer no entumi grow because cancer ninya estrogen na na e grow. Inti se estrogen e block ya cancer ni nya estrogen bi omti obon say with time ni ebewu. Just that you also experience some menopausal symptoms because estrogen na ma ye fefe te say ma. So we do menopause our estrogen level ne bad down na unya hot flashes kakra na won hyehyɛ kakra wa higher o ya kakra na say o ho yera o ti e ma hormonal therapy na ya block estrogen so to me experience menopausal symptoms. Targeted therapy no eno so a new drug aba eno so Herceptin ya de ma wa chemical enye surgery na be chemical and so medical ya ma wa eno so timi ko blocky this HER2 receptors no na cancer cells no ewum. As part of the treatment we advocate nutritional support also timi didi ye because a good diet etimi boa ma recover faster. Your family, not only the family you are coming from but even the church as a family with your support the person is able to recover faster than obia only support at all. In our emotional support and so before I ever started treatment, I be ma ko home psychologist. Normal counsel, they will go through sessions with you for you to be ready for the treatment. The treatment is not always painful. So when you are diagnosed or you know anybody who has been diagnosed of such, encourage the person to go for the treatment. And after treatment, Beyonce will follow you up. Send a bear. In case of anything, we can deal with it faster. So how can we prevent cancer in general? The number one is weight loss. You have to. It was all to me. Yeah, conscious effort say we control weight. And kesiye enye we are kesiye efe, but it comes with own challenges. A bit to say hypertension, diabetes. Aside those ones, so cancer and so on. So you always think about that. So every week. We encourage at least every day, 15 to 30 minutes, be fire exercise. Intentional one. Men can say, be a won, wejuma awoye no, won ante kobanti. That's exercise. No. Exercise is doing vigorous work. You sweat for at least 15 to 30 minutes. If you can do that at least 2 or 3 times in a week, it helps because exercise, no, your body. Your immune system, no, you boost your immune system with that. Your immune system here, very strong so that it will fight against any cancer cells. And breastfeeding. So what I say, now we men can some person we no ever turn to their own breastfeeding there be. Breastfeeding is protective. And it's at least 2 years. By ultimate at least 1.5 years here. It was so to me a year eboa. And avoid smoking. Minim say wa no bian smoke, obi an take alcohol. Ba akwa ka che wunua a ofie. Say smoking alcohol is not good for the body. It predisposes you to getting cancer. Into omuntwa so. You know obi o ha udu menopause sometimes because of this hot flashes I no. If you keep complaining, your doctor may put you on hormone replacement therapy. So that and estrogen is what will help you feel better. And the more you are taking this replacement therapy, the more your chances of getting cancer to increases. So sometimes we encourage you to do certain things to take your mind off these hot flashes and symptoms of menopause. So that is why we are advocating that every October we'll talk about breast cancer so that people will be aware. Yes, cancer once every October. You have an idea, say, if you breast cancer. Now breast cancer so screening it starts with you. One was starting a show in Nufuno. And son cry, you be the first person. Una be first person be say, me for a problem be bahu. And a problem be bahu. Now hospital so yensu ya to aso aye nie ye betumi aye aboa. Ya advocate say mema no at least every October try and examine your wife's breast. So move because usomu no utai someone changes be ba ube notice. Intina ya advocate say mema every October be active. Join us now examine your breast. So these are some of the changes you can see. Please, can we move on? So I'm just showing you pictures of how some of the breast changes we can see. Yeah, maybe I'll bet me who we nufu ni mo and kase ye oh pompo keke na abo me nufu enti me koye e bibidro ebeko debi Fako hospital ne enhye next. Enti we say ne nufu na se keke na ase amoamo akakra ebi abedwen se enye bibia nso so. This is a very good sign say the cause we nufu na se no etimi ye cancer. We de ne nufu no anu no na akohye mu kakra oh ebi a danse mi nu me breastfeeding nti na me nufu na akohye mu da bi we nufu ne ni kwan sa anu ni kohye mu sa nti we nufu na anu na akohye mu sei pe ko hospital na examine wo enhwe se cancer na enye cancer nti we ne nufu na anu na ase crow na ase skin changes bi akoso wo ne nipple na no obo obeka se we crow me de duro bi ko yeso. But a very early sign of breast cancer. And I will say, ahono, and I will share hono. So I say, ekutu ne hono a tokontoko sisi unsana ne de na ebi obedwen say o menufu no na kese keke ba de bi we abnormal to ko hospital na yen share ma. There is also another picture. Okay, enti me endi wa ha say. Now, magic questions. Thank you. It's time for questions. Your questions are Mbisana. All the things you've heard about breast cancer, let's discuss them today. Thank you.
Shalom.
Peace.
Okay, please, I want to find out these supplements, such as the collagens, do they cause breast cancer?
Supplements?
Yes.
Okay.
Such as the collagens.
As I'm saying, the hormones, certain things that contain hormones. So if the supplement you're talking about contains this estrogen, then it's not good for you. Unless a doctor prescribes it, because estrogen is the sometimes if your menses is not even regular, say your menses is not regular, it will do to combine oral contraceptives. So it's a doctor and casa ne diama or the amount for an intended purpose and for a very short time. But say one casa over to BDA is not the best. But if you are fond of taking supplements, you can see a doctor to prescribe a good one for you. And every supplement I will take it, I read the ingredients and see what it contains before you consume. Thank you. Any more questions?
Patrol maybe say once oba or manufua sometimes on some engorgement be and some infections. Maybe some might misinterpret as breast cancer and can over to me the difference between the breast engorgement and the breast cancer.
Okay. Ain't breast engorgement no. Say now one breastfeeding intent man as one express here. We no funu etime ehunu. Enti no there after breastfeeding it resolves. What you say but the air cancer no it will not resolve. It will continue. What you say and I say me share the first picture now me the share you know. One say about wo mu dida because that's where the milk are being produced. Hona milk no ebe produce na free aba. Enti say one breastfeed then the milk stays in those darts. Enti ebema we no funa ho. Enti no do onya start breastfeed and now express pe. Ni na it will resolve. What you say but sometimes obu o ha etimi ekoye infection na akoye breast abscess. Enti no there you have to go to the hospital on be exam on be scans na me kan ye no. Enti omo ya they will conclude say bia a breast abscess and also eno ye be draini nufunsuo na akemu ye be draini na BBI fine. What you say? And see, those ones you see it will resolve. It will come back. Your breast will come back to normal. But breast cancer, no. Once it has started, I bet also amana bad.
Okay, so I just want to make a contribution from the pharmacist perspective. That has to do with one of the risk factors you mentioned, the contraceptives. Yes, we ideally the oral contraceptives, the emergency contraceptives are supposed to be taken just twice in a whole year. So the 12 months, you can only take the emergency contraceptives twice. But we have people walking into the pharmacy every week or every other week coming to ask for Lydia Postino 2. You can't have an emergency every week. If you know you will have an emergency, then go for the long-term ones. When you go to a clinic or a hospital, they'll put you on a long-term contraceptive. The pills you come for are for emergencies, and you can only take it twice a week. The more you take it, the more you expose yourself to the hormone estrogen, as Dr. Adu Gyamfi has said, and that increases your risk of getting breast cancer. So please, take note. Thank you.
Thank you. And let me add this to it. So the combined oral contraceptive, we have different types. And a bianin estrogen level ewo. And so one can walk to the pharmacy. Now can say open COC and now pay pills. They'll give you any, but Uber hospital, we look at the hormonal content and see which one best suits you. Uber will look at your BMI, like your body, and even educate you on which one will be good for you. Don't just walk to the pharmacy shop, say, oh, contraceptive pill for even the 30 days. Go to the hospital and let them prescribe it for you. Thank you.
Doc, please, I wanted to ask a question. I know that people who have PCOS sometimes have to take contraceptives to manage their. So I'm asking, please, do people like that have high risk factors, or like they have high risk of getting the cancer? Thank you.
All right, so PCOS, we give you, as I was saying, the estrogen content that we give you is reasonable, it's very low. And we are giving it to you to help with your symptoms, because a boy with even the weight gain, a boy with hair now, a boy with pimples. And see, combined oral contract, they are good, but if the estrogen level is high, if you are taking it for a very long time, then it's bad. So the PCOS, we are giving it to you to treat. I'm not sure they will ask you to take it for, let's say, 5 years. No. We give it sometimes 3 years. 3 months. Or maximum 6 months. So you don't give it for a very long time. We give it once your symptoms have been managed, we will be asked to stop. And our PCOS, it depends on what your problem is. And your obia na yema no COCs no. Patroti ase. Obu aha oba na problem here. I want to mean wa. We have drugs we give you. Uba na would need a hair. Hair no krenye always na a mau combined oral contraceptive. There are other drugs that we even give for every symptoms you have. We have different drugs for them. So it's not that once you have PCOS, we put you on COC. We look at you and your problem and what will be best for you. But if you are putting you on the COCs, now your man will load those and for a short time. What I say. So it's not like when you have PCOS and you are taking it, you have a higher risk of getting it.
I just wanted to add to what you said. I'm a survivor. Yesterday was 3 years since I had my cancer. And I just wanted to add that it's not always pain. It started like Yadimiko Asheho, and it was coming and going. It was coming and going. And then when I've got a medical background as well. So when I examined it, when my husband examined it, we realized that there was a little bit of a nodule there. And so when I went, thanks be to God, it was in the early stages. So just to add on to that it can be treated. I went through chemotherapy, I went through surgery, I went through radiotherapy. So yesterday was my 3rd year. I've got 2 more years of review. It's, just to add on to that, yeah.
Thank you. Thank you. And see, she is a living testimony to the fact that if it's detected early, you can have cure. And yes, sometimes the only thing you may feel, the obeti me experience a pain. But pain no dream esi so say, cause she be ana bibi shewo. Sometimes pain no, you may not even find any nodule. But once it keeps coming and going, go to the hospital. And mammogram, ultrasound, they can even see cancer cells. It hasn't even turned into nodule yet. And so, there are different types of breast cancer. So we have different types. If you have every lobus, so there are different types. But one of the dangerous one, inflammatory breast diseases. And see, inflammatory, the NHS say, as a unya infection, they were no. Ebu ha sape na be hu enufu ni say koko, but by the time I be hospital no, na a spread it even to distant parts to say your liver and your brain. And see, so who be skin changes be pain. Ebu okrampa who feeling no do. You just go for them to a clinician to examine or examiner of listen now. This thing we have to take it further. Yebema wakoye test. And I want to advocate here say Obabia after 45 years do one mammogram. We are less than 40 years, we don't advocate for you to do mammogram because our breast tissues are very dense. Since yes, and we mammogram now they may not get a good result. But after 40 years, Bianco Babia, one mammogram, Fatu, at least this is the baseline. You know, said there is no problem. Then you can do it every 3 years. Every 3 years, yeah, you do it as a follow-up. But we also do that because mammogram, no, it can detect cancer even when you haven't even started feeling any symptoms. As I said, the earliest you may not even feel anything at all. The only thing is that you might go to the hospital just to go and do a mammogram, and they may even detect it as early as stage 0. Thank you. So, mommy, there are radias so and we pray that as you go for your continuous follow-up, you'll be declared as cured, and you may not even need the follow-ups again after 5 years. And maybe they'll even do it every 5 years for you. All right. Thank you.
Doc,
So please, before you come, so meaning that if you have female children or sisters, advocate for them to go to the hospital at least when they are 40 years and above to go and get mammogram done. And yes, so every month, after their menses, they should aggressively be examining their breast. So after the questions, I'll show you how to do the breast self-examination. Okay? See, I'll teach you how to do it. A question here.
Doc, thank you. Concerning the intake of contraceptives, there are some of us that suffer from amenorrhea. That is absence of menses for a long period of time. And there are cases where it has to be treated with contraceptives. And since you have to take it for 3-6 months, there are sometimes that it has to be lifelong. And so if in cases like this, is there a chance that, we could also contract breast cancer, as well as the discharges? When it comes to amenorrhea, there are days that your breast will discharge breast milk, even if you are not breastfeeding. And so I'm asking that if it has to be treated, is there a way that we can go off the contraceptives so as not to suffer the consequences of breast cancer? Thank you.
All right. Thank you for your long question. So, when you're on contraceptives, say, far contraceptive, now menses in bar. There's no need for you to get combined oral contraceptive. That's the truth. So menses in bakra is even better for you, as I was explaining. Say, unyima, you don't have your menses. Uko menopause, I don't have your menses. So the estrogen level is low. So ufa contraceptive, nema unya menses. There's no problem actually. It's even good. You get it? And mind you, it's when you're on contraceptive, it also saves you from a lot of problems. So menses in bar. Don't be in a rush to go to the hospital. So I'm open some menses bar every month. There is not really any need for that. But every month we a menses. Fine. Every month we menses. There are other options of family planning now. You may have your menses every month, so you can discuss that with your service provider. But sometimes we give you the contraceptive, not for a long time. As I was saying, contraceptive, when we are giving, we don't give it to you for a long time. Hello? Into contraceptives, we say the manage you amenorrhea now. See, the manage you amenorrhea now. Yeah, mouth for a long time. It's supposed to be for at least 3 months, because by 3 months, your body will be able to regularize the menses. Now menses not flu normal. But so you'll be having your menses every month is your priority. Go, they will change it for you to get some that will help you have your menses every month. But what you are saying? Okay. And I think there was, have I answered your question? Or there's one last. The discharge. If you are not breastfeeding, you are not supposed to have breast milk coming from your breast. So once you start seeing that, so now it's a problem. It's not normal. Go to the hospital. Sometimes we have estrogen. We have certain chemicals, a friend prolactin, and also a strap. It's mima unya breast milk coming, even when you are not lactating. And prolactin also has its own issues. And once I will say, but whilst you are not breastfeeding, it's not normal. It's not normal. Last will be say, yes, we have menopause, and now it's not normal. So please, once you start seeing that, go to the hospital and let us verify what the problem is and deal with it. Thank you.
This one may be, I just want to find out that if you have had a hysterectomy, is it beneficial, or does that prevent you from getting breast cancer? I want to know that.
It is a hysterectomy, just say, you are with the no. If you are now a problem, you are with the no. You are with the na. It doesn't reduce your risk of getting breast cancer. Estrogen is being produced by the ovaries. And to say, you are with the ovaries now. And no, it reduces your risk of getting cancer. But what I say, estrogen na make no ovaries ninkosiano, and it produces that chemical no. And to say you are with the NC kosiane can with that, then your risk reduces. But I won't say ovary, but I said they also have small amount of estrogen maybe. And your kosiane kwan so they produce estrogen, that's the thing. certain things in your body mo eboa produce estrogen kakra enti na ukọ menopause at least hot flashes no manage ne kakra because enye kosua ne nko aha enti ye you are with the nko you still have the chance of getting cancer if your egg say ukosua ne da so ewo ho aba ye ka ho then your risk reduces.
Doctor, me person we bisa say o ka say nyina na am say e man ne de na o ka pa. Person we bisa say e mema no o say wo e mema ndu ho a o malufo no to say e ma de e na ye wo ye nso ye mama normal ones. Person we bisa say ye de no difference be na wo ye be de na ho science and sense to me say enu focus ye no ana ketewa no na be mo hu say wo ye nya emma cancer no bia na say senatie. That say na apin so age no na ye de hwe anase no so ye be de na ye hu no.
Okay, so I'll start with the last one. Cancer increases with age. A man cry say who from 45 kono now rates of getting cancer no so increasing. A man no the can symptoms na ye kan eni nyina we no fu be ho no e be ya wo ya moja be fuma ba na otimi hu aba wo mi nyina to mi si ewo wo obema ne mu just that a mema no is one kakra like enye common but etumi si eno obo ha otimi wo e bi a problem bi won the body no ma na estrogen level na akosro what you are saying once your estrogen level goes high no your bema cry you can get it eno enufo no esun ana eso ani nyina cancer betumi pie ma but just that say na me kind obesity unza wo ye kese a wenufu bi baby a ye kese so enufu no so fat no so do so and the more fat you have no the more your body never convert certain things to estrogen then the more estrogen you are exposed the more risks you have of getting cancer that's what I say.
Okay. Hello me person say minim guy bi enufu na no ade bi hye ho Eshe ne ha say. In fact, no many in a school. And I don't know. Then.
Oh, so Jose, what you call a wisher mouth? Yeah, who do any? Me, who need that? So I can't really tell what it is. But I was so cool. Sometimes it's just fibroadenoma. Fibroadenoma is benign, like just swelling in the breast, fat no na aforme aboa no so kwa omutimi yi fat no na omudi nti bibia ebe yi obody mu bia so de be call lab akwa examine ahwe say cancer woman na cancer anim what you say encourage no so on hospital on be scans ama no on be take biopsy if it is needed no ma share ama no say something e be ha na patcho what you say. Okay.
Doctor, me person me busa say no say eba anase bia oba bi feel say onya pains bi na wako heba say opa eduro say ote say the pains e wo eye na nufu no mo anase ne chest no a heba no eye anase enye na person me busa.
The truth is cancer so far, you hear about you say to me treat cancer. Documented. I mean, science, there are experiments about with conclusion. There is no any documented way be HSA herba no to me cancer cells via. Into on your pain, the advisable thing is say Obeko Hospital. So Oko Hospital, not say anything serious. They will give her medicine to manage the pain. And if it is nothing, once you manage the pain, everything will resolve. And sometimes when your bra now bra too tight. Obo ha that year then me starting and yes my cancer, but sometimes it gives you pain and discomfort. And see manage all this, share bra board the number of times I will and reduce it for you. And if it's nothing, mostly this pain will resolve. But if all results to herb and I say something serious, by the time I'll be do hospital, now I spread it, then the cure becomes difficult. patriarchs.
My question is two. Number one, me name nipa mienu a omenya cancer. Na advice omo mind say family planning. Into omo can say family planning is not good. We should use the calendar. Through that, no omo efim eko. Me son mo bi ono last week. Ye cha nenufu for 15 years. She is living. No, she baby like socks. Me name what is it? Ono nso efim onya attack no 2 days. Yade no call hospital no film. Na dia me pese me hu ne say bia wo first one, second one, third one wo pese wo titi wo man ntema. What is the best thing you have to do? Like, do you have to do the family planning, or there is something that you are supposed to do? Because yeah man, sometimes mistake to me back. Until you have to, I want you to advise us on what to do to prevent all this kind of like.
So the first thing is that it's not that the contraceptive is bad. Actually, UFA combined oral contraceptives it's protecting you from ovarian cancer. It's protecting you from endometrial cancer, cancer in the womb, cancer animal. So the combined contraceptive it's not like it's bad. But as I'm saying, we don't take it for a long time. Maybe I want to space your children. Will you space your children over 10 years or over 20 years? No. If you don't space your man some 2-3 years, what you say? And a man can say productive age is from 15 to 45. Obo have from 40 years from now starting hitting menopause. Now the menses now starting irregular. It's just a menopause na isha asemeno. We look at you, we look at your body, and we advise. There are different types of contraceptives. There were combined oral contraceptives. There were estrogen and progesterone. We have only progesterone contraceptives. There were IUD. They say what would you chemical beyond him. They say what would you implants? They say it contain just progesterone. There were cycle beads. There were injectables. Injectables no containing only progesterone. What you are saying? We have different types. And to let them take you through all of them. And who you should be a combined oral contraceptive for your first child, it doesn't mean that you should take it for the rest of your life. Maybe after second one, you can try another one. And the IUD, it prevents pregnancy over 99%. There is no chemical in it. Just that you be I had them say yes, sir, but you be who multiple sexual partners and now you'll be prone to infection. Condoms are there. Condom, apart from preventing pregnancy, also protects you against cervical cancer, protects you against sexually transmitted diseases. What you are saying, there are so many types of contraceptives we can use. And it doesn't mean you should just be on one for the rest of your life. You alternate them. And second one, you try to look for them. You try to look for now. It's not share socks. The socks not share to prevent lymphedema. So lymphedema, just say you will look for now. Sometimes breast cancer no alcohol. Yeah, before you are most of any lymph node. If you have cancer na lymph node, they have to take those lymph nodes out, and those lymph nodes a draining fluid from your hand. It's almost take it. That function will not be there. It's in silver veg now in sanimo. It's almost the socks now. A change it helps drain the water in the arm. It's a man in sunny and for 15 years. So I'm sure for 15 years that's good. She has lived for a very long time after the surgery. But as to what killed her, you can't conclude say a cancer and then cancer because it can be 2 years, 2 days. It could even be a heart attack. It could be something else. I just saw my autopsy. Don't know what exactly killed her, but you can't conclude say a cancer Because cancer in the buy and the other breast will start experiencing symptoms. Or be call hospital, they'll tell her it's a cancer number, but 2 days, cancer in the buy is not likely to be the cause of her death. You can even form clots in your heart, P. So there are so many things that can happen for you to die instantly.
Ni baby no. Yede ne ma obi ema onya breast milk mano. Ebi nkwa kono kwa wa no so awu awie. Sa nipa no obetimi anya breast cancer na.
Nipa na yede na mano no. So ogusu ma kola elufu ana.
Debi. No awu kura wie.
Nti enya advisable.
Okay.
Enya advice. See am put the formula ba. Yeah, cry away before I breastfeed. We are still giving formula. It is here, say, obi free one. We don't advocate for that. Formula or why? It be ma kolano. We any year kwa kolano be any year.
Kano nana meka. Nkese gure atwam bi na me ya bofra kakra. Na sa na omo ye. Na me kusa say no na emma breast cancer.
It's no because my meme away and it's not even advisable to say about breastfeeding. But I know, and yes, I know, mommy na colano breast cancer, baby.
Doc, please, I want to find out if we have anything like fibroid of the breast. Because, yeah, I saw someone having a surgery and the person said it was fibroid. So I was.
Your friend is fibroadenoma. And see, fat cells are collecting. That's the same thing that happens in the womb. As a fats now collecting your womb, you now have fibroid. It's like nodule, but you say fibroid now. What would you do when I be pure enough in the day? It's just that I would know fat. We do know fat is meaning to me for me nodule. It is just a name, fibroadenoma, but it's not fibroid. No, I would not be pure enough in the. That's what I say. Question because this is the last set of questions I taking.
Hello. Yeah, Doc, I want to find out, as a way of encouraging us for the monthly checkup, when you go to the hospital, averagely, how much do you spend for the checkup?
The labs?
Yes.
Okay, so I don't have the exact. Is it for the screening or for treatment?
For the screening.
For the screening. For
yes.
the screening.
I'm coming on. You are encouraging us to go for the checkup from our dear mother. So I want to know, how much do you spend when you go for the checkup?
Okay, so when you go, the doctor will examine you. So maybe consultation fee, I don't know. It depends on the hospital you go to. If you have insurance, you may not even pay anything at all. When you go, they'll examine. If there is a need for you to do further tests, ultrasound, maximum should be about 150. But there again, it depends on the hospital you go to. If you go to those private big hospitals, the charges may be higher, for which I can't tell. But maximum I know, ultrasound should be about 150. Then the mammogram is not more than 400 Ghana. But when this October like this, they have all the prices. So when you go, you may not even spend more than 200 Ghana. So when you go, they take it one step at a time, depending on what they see and what they will encourage you to do. But when you're a woman and your family member has had the breast cancer before, from 40 years or 45, you do the mammogram. And that one, as I'm saying, it is not more than 400 Ghana, depending on where you go to. I think please, this is the last. If you have any question after, you can see me, then we'll talk more about it. Thank you.
If you have had the mammogram continuously for, I think, 3 times, and you stop, is there the need for you to do again after some years? Some of us have had it for about 3 times or more, and I've decided not to do it again. So is it right?
So as I was saying, once you do first one and there's no problems, and depending on the risk factors that we know you have, we recommend you do it every year if you have a higher risk. If you don't have a higher risk, every 3 years. If your risk is even lower, or you've done it 3 times and we may even recommend you do it every 5 years. You get it? So you don't stop at all because you are still living. You don't stop at all. Once you're a woman, as you are even aging, the risk is even increasing more. Yes. So you don't stop at all. Thank you very much.
Doc, I think you are forgetting something. You promised to demonstrate how to assess the breast.
So the examination. So after your menses, about 3 to 5 days after your menses, as a woman, you stand in the mirror. Then you raise your hand, both hands up. So if there are any changes, so you raise your hand, both you look into the mirror. If there is any nodule, it will show, it will pop up, or you see some irregularities where the nodule is. So once you do that and you see that the contour and everything is fine, then next you can either lie down in the bed or you stand in the mirror again. Then you start from one end and you come back to the same place. So you start from here, your chest, you come all down to where the nipple is. You go all round to where the nipple is. You see? Then after you come to the armpit, as I was saying, there are some lymph nodes there that can also get enlarged. And some people's breasts go all the way to the armpit. So you come and you palpate inside. You palpate if there's any breast there, you palpate there. Then you come to the nipple, you squeeze from the top to the nipple to see if there's any water or any blood or any discharge coming. So every month after your menses, try and do this. You are not using the fingertips, you are using here, the palm of your finger. So you go all round. If there is any nodule, you notice it. There's already lump in the breast, that's where the milk is coming from. But if there's any additional lump, you will notice it. Thank you.